Syphilis is a sexually transmitted infection caused by a bacteria. It can be serious if it's left untreated or passed on to a baby during pregnancy or childbirth. The number of people getting syphilis has greatly increased over the last 5 years. You could be at higher risk if you are a man who has sex with men, have had sex overseas, have had multiple sexual partners. How do you get syphilis? Syphilis is usually spread by contact between moist skin areas anywhere on or inside the body. Some of the ways you can catch it include unprotected vaginal, anal or oral sex without a condom, kissing or licking the anus, sharing sex toys that aren't washed or covered with a new condom each time they're used, your genitals coming into contact with your partner's genitals. This means you can get syphilis from someone even if there is no penetration, orgasm or ejaculation. It can also be passed to a baby during pregnancy or childbirth. Syphilis also makes HIV easier to pass on and catch. Symptoms of syphilis. Many people with syphilis will not notice any symptoms either at the time of infection or later. Syphilis usually has 3 stages. The first stage, primary syphilis, 10 days to 3 months after infection. A small, painless sore or ulcer will appear on the part of your body where the infection was transmitted. This is typically on either the penis, vagina, anus, rectum, tongue, lips. Most people only have one sore, but some people have more. The sore will then disappear within 2 to 6 weeks. If the condition is not treated, syphilis will move into its second stage. Swelling in your lymph glands, such as in the neck, groin or armpit, often happens with the ulcers. The second stage, secondary syphilis. The symptoms of secondary syphilis will begin a few weeks after the disappearance of the sore. At this stage, common symptoms include a non-itchy skin rash appearing anywhere on the body, but commonly on the palms of the hands or soles of the feet, tiredness, headaches, swollen lymph glands. Less common symptoms include fever, weight loss, patchy hair loss, joint pains. These symptoms may disappear within a few weeks, or come and go over a period of months. Syphilis will then move into a stage where you will experience no symptoms, even though you remain infected. This is called latent syphilis. You can still pass it on during the first year of this stage. However, after a couple of years, you can't pass the infection to others, even though you remain infected. The latent stage can continue for many years, even decades after you first become infected. Without treatment, there is a risk that latent syphilis will move on to the most dangerous stage, tertiary syphilis. The third stage, tertiary syphilis. The symptoms of tertiary syphilis can begin years or even decades after the initial infection. Up to 1 in 3, 10 to 30% people who are not treated for syphilis develop serious symptoms eventually. The symptoms of tertiary syphilis will depend on what part of the body the infection spreads to. For example, it may affect the brain, nerves, eyes, heart, bones, skin or blood vessels, potentially causing any of the following symptoms: stroke, dementia, loss of coordination, numbness, paralysis, blindness, deafness, heart disease, skin rashes. At this stage, syphilis can be dangerous enough to cause death. Testing for syphilis. If you think you may have syphilis, you should make an appointment with your GP or local sexual health services. The only reliable way to tell if you have syphilis or not is to have a blood test. This is usually sent to the lab. However, in some sexual health services a same-day test can be done if you have symptoms. In the very early stage of the infection, syphilis in an ulcer can be seen if a swab is taken from the ulcer and looked at under a microscope or sent to the laboratory for syphilis detection. These tests are only available in some sexual health services. Treatment for syphilis. Early syphilis infections can be easily treated with antibiotics, usually penicillin, even during pregnancy. In late-stage syphilis infections, treatment at any time can stop further illness and cure the infection itself, though it does not repair any damaged organs. Treatment is usually given by injection and may involve 1 or more doses, depending on the stage of the infection. In some cases, tablet treatment may be offered. Once the treatment has finished, further blood tests are carried out to make sure the infection has gone. These tests may be required at intervals for up to a year. Avoiding passing on syphilis to a partner while you are being treated, and until you get a clear test result you should not have any kind of sex. Avoid intimate contact with your partner and others. This will stop you from infecting your partner if they're clear, and stop you being reinfected if they also have syphilis. Your partner should also get tested for syphilis. It can be hard to spot in its early stages and they might not realize they have it. They will generally be offered treatment regardless. Syphilis and pregnancy. Syphilis can be passed to a baby during pregnancy and childbirth. All pregnant women in Scotland are offered a syphilis test. It can be successfully treated during pregnancy with a course of antibiotics. The treatment does not harm the unborn baby. If syphilis is left untreated during pregnancy, it can cause serious birth defects, miscarriages or stillbirths. Reducing the risk of syphilis. The best way to prevent all sexually transmitted infections is to practice safer sex. This means using a condom for vaginal, anal or oral sex.